Hello everyone and welcome back to the channel. My name is Kitty and I'm an academic junior doctor working in the UK. Today I want to take some time to reflect back on my time at university and what I've learned in my 5 years in medical school. Let's dive right into it. Firstly is self-directed learning. This was a bit of a shock for me when I entered medical school because in high school you usually have a teacher who teaches a class of 20-30 students and they have a relationship with that teacher throughout the year. And this teacher can offer you individual advice, they know what your strengths and weaknesses are, they know what you need to work on, and in general you get quite good support. Compared to when you're in university, when you go to lecture-based teaching, you might see a lecturer for the only time in your life for about 2 hours, and they will have a lecture hall full of 200-300 students, so they're never going to remember you. And even though universities are moving more towards a problem-based learning or case-based learning model with more tutorials, even in these small groups working, you will still have much less support to when you were in high school or in any other stage of your life really. And as a result of this, you have a lot less guidance on what you need to do in order to actually pass the exams and become a good doctor. Especially as you go into clinical years, the idea of a mentor or a teacher who looks after you for the entire year almost completely disappears, and you're put on placements in hospitals, going from ward to ward, from hospital to hospital, and seeing different people at every step of the way. In addition to that, there's so much in medicine that everyone has to accept that you can't actually learn everything in it. You can be a consultant in your 50s and you'll still be learning new facts every other day. So as a medical student, you really have to develop smart study habits so that you can focus on the big picture and learn the common things that you need to know and to become a good junior doctor. The tips that I can give you for this is maybe in the first 2 years of medical school where things are less stressful, develop a good study habit and find out what works well for you, whether that's learning via flashcards, learning by reading lectures, taking notes, watching videos of other people explaining things, reading textbooks, or doing question banks. Just find out what it is that works for you. Try and develop your own brand of studying that works well for you and your learning and your knowledge retention and memorizing for exams. Another tip I can give you is think about using resources that other people have already compiled before you. Because medicine is so broad, if you were to make notes on absolutely everything that is your own handwritten words, you'll probably end up spending a lot of time and a lot of effort in doing that when you could be utilizing your time a bit better by using what's already out there. Now, I'll be the first person to admit that sometimes I don't get along with other people's notes because often they're not structured in the way that my brain learns personally, so I end up trying to make my own notes, but just be aware of the resources that are already out there and saves you the trouble of having to look up, for example, the anatomy of a hand or looking up diseases and things like that. Using compiled resources like the Oxford Handbook of Medicine, which is a really concise summary of a lot of diseases that you need to learn eventually. Websites like Teach Me Anatomy for your anatomy learning, or Teach Me Surgery for surgical topics, or Flash Finals for pre-made Anki flashcards, that sort of thing can really help boost your revision and also highlight maybe areas that you would have missed yourself if you didn't read other people's notes. Aside from self-directed learning, another big thing that I learned from medical school was the importance of taking opportunities in your own hands outside of the curriculum and pursuing your own interests and creating opportunities for yourself. Remember back in medical interviews, people always use this phrase, "Oh, medicine is a vocational career." But what does that really mean? And I didn't really grasp this until I was midway through medical school. Everyone takes it to mean, oh, it means you'll be learning for the rest of your life, which is true, but it also means that your hard work doesn't stop just at the medical school curriculum and certainly not when university stops. As a medical student, your journey in medicine is only just starting. And like any other job in the world, really, when you think about it, you have to do other things and create opportunities for yourself and create advantages for yourself, boost your CV, pursue your interests, show that you've networked in order to really make you an attractive candidate for the future. Because the thing is, when you graduate medical school, which I don't doubt all of you would because you're all brilliant people, but when you graduate medical school, you eventually have to apply for jobs. And when you apply for jobs, you will have certain interests and specialties you want to get into and things. And they can be a very competitive process. And at the end of the day, the person with a good CV who's put in the effort to do extra research projects or extra leadership and team working roles or extra education for their fellow students or other people will have a much better shot at getting that job. So be proactive and pursue opportunities, whether that is getting involved in research projects and audits or getting involved in a leadership and team working role, or providing some medical education to other people, or networking or attending courses and conferences, or just in general exploring what you like and don't like. When I first got into medical school, I was very complacent because I thought I had an in. I was going to become a doctor and I just need to do what I need to do to graduate and that's it. But actually, as I realized later, there's lots more that you can do to create advantages for yourself in the future. And looking back, as a medical student, you have so much time to devote to this, and you also have resources from the university, and people are generally really nice to students who show interest. So just take advantage of that whilst you have the time, because trust me, when you're a full-time working doctor, a lot of this suddenly go away and you really wish you would have done something earlier. If you want to learn about how to boost your CV in those ways, I do have a series on my channel which looks at how to build a medical CV as a student as well, which you can check out. Another thing that I learned in medical school was how to deal with imposter syndrome. Imposter syndrome is when you feel inadequate, either because you think that, oh, actually, I think this is all a fluke, I got into medical school out of luck, or you're comparing yourself to other people and you think, oh, they're doing so well and I'm doing none of that, so I must be really crap. And this is a feeling that a lot of people will have throughout their careers, and probably you will experience multiple times when you're a medical student, when you're a junior doctor, or even when you're a senior doctor. I think this is especially hard when you first get into medicine and you go from an environment of a school, for example, where you were the top 10%, and suddenly you're now thrown into an environment where, for the majority of us, you're now the middle of the pack. You're the average person in that lecture theatre, and it can feel quite disorientating when your marks reflect that. And this will translate to your clinical years as well as a medical student, where you feel like, oh, I'm not communicating right with a patient, I'm not speaking confidently enough, I don't know enough about this disease, or when a consultant quizzes you, you're like, oh, I don't know the answer, I must be so stupid. But actually, this is all part of the learning curve for everyone, and it really, at the end of the day, just shows that you have insight and you know you need to be better, and I know that you'll go home and study, and then you'll be better and you'll know the answer next time. And the way that I personally dealt with imposter syndrome was a lot of faking it till you make it. So I am a very shy person for almost all my life up to university, and even now I'm very introverted. But what I learned was that there really is no place for that when you have to interact with a patient or when you're trying to do an OSCE. And the only way to get past that is to keep practicing telling yourself that actually you know the answers, you know, you're going to be a doctor, and act confident and speak confident like you know all the answers in the world. Speak to the patient like you know exactly what's going on, act like you know exactly what you're doing, and eventually, through practice, you will both gain enough knowledge and clinical skills to actually be able to do the thing that you want to do, and you'll also trick yourself into thinking, actually, this is fine. And when you act like you're confident, you will be confident, and you come across as you know what you're doing, and you'll get high marks. And the other thing about imposter syndrome is try not to compare yourself to others. I know that's easier said than done, but in the age of social media, I find that a lot of medical students will sometimes post on social media like, oh, I published my first paper today, or I presented at this super amazing international conference, or, you know, they're studying 8 hours a day or something ridiculous. But just remember that the golden rule of social media is you're comparing your realistic life to the highlights of someone else's life. So don't believe everything that you see. Know that everyone also has the same feeling. I guarantee you every medical student, every junior doctor will have felt this way at some point, like they are not supposed to be there, or they're not a good doctor, or they're not doing as well as they need to. And I think as long as you're happy with how much you have done and how much you have progressed and how you're coming across to patients, because you know everyone knows how well they did, and they know if they're shit and they know if they're good. So as long as you're happy with yourself, I think you wouldn't have done anything wrong. The fourth thing that I learned in medical school is that a good support network, both academically and personally, is really important. Personally, it goes without saying, you need a good work-life balance in medicine. It's bloody hard. You got into medical school and it's only going to get harder from this point and for the next 10 years of your foreseeable future. You'll have to work hard to do exams, you have to work hard to even be a good competent doctor, and there will be good days and bad days, and having a good support network of people that you can talk to, who can share your interests and also tell you about things outside of medicine, is really essential to keeping balanced. And it's also important to have a circle of support in the academic/clinical world as well. So having senior students who can give you a bit of advice about how to navigate the difficulties of medical school, or having senior doctors who can help you and give you some advice about things that you can do to boost your CV and get into a certain specialty, or even how to choose a specialty, or, talk about and discuss the difficulties of training in medicine is really important as well. I think when I first got into medical school, I was one of those people who rolled my eyes every time someone said the word networking, because I thought, well, I've got this far so far, I can definitely get through medical school on my own and do all this stuff. But the sooner you realize that actually having senior mentors can only help you, and having a network of people who can give you advice can only add to your experience, the better off you will be in terms of planning for the future, as well as finding opportunities to do extra things. The fifth thing that I learned in medicine is don't let the stereotypes get to you. In medical school, and in fact amongst the working healthcare professional population as well, people have preconceptions about what certain specialty doctors are like, and as a result, for better or worse, this puts people off certain specialties, or it makes people think a certain way about others, and I think it's ridiculous. I think if you like a specialty, you're interested in the medical side of it, you should pursue it. I don't think that it's ridiculous to say, oh, all cardiologists are arrogant but clever, and or GPs are friendly but boring and GPs crap. Usually people who are making these comments have never worked in those specialties. They don't know how hardworking GP is. They don't know how much they have to do. And people who say things like, oh, women can't be surgeons because then you can't have a family. Don't believe any of that. There have been many people who have done it before, and there are many people who will do it who come from a diverse number of backgrounds, who all bring their own individual special skill sets and their personalities into the mix. So if you want something, just do it. Don't believe anyone who says you can't do a certain specialty because of XYZ, and don't believe anyone who says you shouldn't go into this specialty because of XYZ. If you want to do it and you find it interesting and that's your passion, go for it. You know what I mean? And anyone else who says otherwise can go and take a hike. And finally, and perhaps most importantly, you need to maintain a good work-life balance and have hobbies. And honestly, if you have hobbies from before medical school, please continue them, and also learn new hobbies as well. I promise it will pay off in more ways than you think. Because one, it's a distressing activity, because medicine is really bloody hard, and we said earlier, you need a good support network, and you need ways to be able to unwind and relax. You can't always be working, whether that be studying for medical school or doing other extra stuff to make your CV look good, because at the end of the day, you can be the best doctor in the world with the most impressive CV ever, but if you're miserable, who cares, And in fourth year of medical school, I definitely did way too much, and I got burnt out really quickly, and I was just really miserable for the rest of the year. I just kind of thought oh, why am I slaving away doing all this stuff, even though I was seeing really good results on the other side. So you just gotta be careful, because it can be such a stressful career already. And you just need to find ways to balance yourself out. And at such an early stage in medical school, if you can start developing those healthy habits and keeping yourself happy, keeping yourself physically fit, it will make your life so much easier. It can actually help your studying as well, because studies have shown that if you do physical activity, your ability to memorize will be much better. And in terms of hobbies are so important. I cannot stress this enough. And again, not only for your personal relaxation, but also because in a sea of, simply because the training requires it, right? Everyone at the end of the day will have done some kind of research. Everyone at the end of the day will have done some education. Everyone will have done some leadership and team working roles, and everyone will have attended some courses. But amongst consultants, or if you're applying for a position on a society committee and things like that, actually having other skills is so much more helpful. And I've found that selling points for me when I apply for these roles, so I'm quite into video editing, I'm quite into graphic design, I'm also interested in music, and I did a bit of website design when I was younger, back in secondary school, just because I was interested. And all of these things have actually made my applications to various things a lot more attractive, because you'll find that a lot of times people don't know how to design a good flyer, or people want to put out educational content but they don't know how to edit the video and put it in an accessible form, or people want a website to host their stuff and didn't know how to do it. And having these extra skills actually gave me a lot more of an advantage when it comes to this sort of stuff, compared to someone else who says, oh, I've done 10 research projects and whatever, just because it's a skill that not a lot of people have in medicine and you don't expect people to have. So having hobbies, really important, not just for yourself but also in your working life as well. So those are some of the most important things that I've learned in medical school. I'd be curious to hear what your thoughts are, whether you think there's any other particular challenges that you want me to address, or something else that you're struggling with that you want to ask me about. Please leave a comment below. Don't forget to like and subscribe. That's it for now, and I'll see you next time.